Mr. Kopic, how are you doing today?
I'm well. How are you, sir?
Oh, I'm doing fantastic. My name is Nick. We've worked with each other before from physical therapy, if you remember.
Oh, yeah.
We need to do some tests for your arteries and veins and just get a good look at your feet and all that good stuff. Are you okay with that?
Mm-hmm.
Okay, good deal. Are you able to take your socks off?
Oh, yeah. Wonderful. I'll just take one off. Is that cool?
Let's do both.
Okay.
Okay, and then we'll put them back on when I have you get up and walk around here in a minute. But
Sure.
we're good here. So just doing a little, quick and dirty foot screen. His feet look great. There's nothing no deformities or anything going on. There's no pressure sores. Primarily that would be on the back of the heels. I'm not seeing any arterial wounds, which would be on the inside of the leg, medial leg, and then venous wounds, and I'm not seeing any of that. Not seeing any excessive swelling. So we're going to start off with capillary refill. So I'm just going to pinch your big toe here. What I'm doing is I'm just going to hold it until it gets a little pallor to it, and then I let go and look for it to refill, get to that same color that it was, and it seemed like it returned in about a couple seconds. So yep, so we're good there. So if it was more than 2 or 3 seconds, then you would expect some that would be a sign of arterial insufficiency, but you're good. So now let's do your pulses here. So we'll do dorsalis pedis here first, so at the top of the foot. Okay, so I would grade that a 2+, so that's normal, easily palpable. And then we'll do posterior tib. Okay, I would also grade that a 2+. You're good, thank you. Do the same thing on this side here. All right, 2+ there. And 2+ there. Okay, wonderful, Mr. Kopic. So now we're gonna do. Go ahead and sit up for me. Good. Not feeling dizzy or lightheaded or anything today?
I'm all right today.
Good. All right, lie down, please. So what we're going to do, we're going to lump together rubra of dependency and venous filling time. So you're looking for two main things there. For rubra of dependency, you're mainly looking for, the color of the foot. So we're going to take a look here, and it's, I would say, pink, just a pink color. And then I'm also looking at the veins of his foot, which, not seeing too many veins medially, but in the middle and on the lateral side, I can see some vasculature. So take note of that, and then I'm going to elevate his legs here. So I'm just going to bring your legs up, okay? Right. And you're just going to go to about 40, 45, 60 degrees, somewhere in there. Feel all right there? Is that any pain with that? So what you would do is watch the legs as you do this. You would hold the position for a minute. I'm not going to do that to save our time here. So now let's pretend it's been a minute. Mr. Kopic, I'm going to have you sit up and then hang your feet off the side of the table, okay?
Okay.
All right, and let's go. Okay, good. So now, while I have him here just in case he was wanting to pass out on me, I'm gonna wait and see how long for him to get his color back, and then B, how long it takes for his veins to fill back up. And it looks like both of them came back in around that 10 second mark. So you feel good, comfortable? Okay. So that's normal. So 10 to 15 seconds is normal for both of those. If it is above 15 seconds for the to get the color back, the rubric of dependency. That would be an indicator of arterial insufficiency. Less than 5 seconds for the venous filling time, watching the veins come back. Less than 5 would be a sign of venous insufficiency, and then more than 15 seconds would be a sign of arterial insufficiency. Okay. The next thing we would do here is get a ankle brachial index. We don't have the stuff for that, so can't do that, but that just involves getting a systolic blood pressure for the ankle, and then the upper arm, the brachial artery, and then dividing the ankle from the brachial, and then, doing that. Normal is 0.9 to 1.1. Anything above that is an indication for calcification. Anything below that is indicative of arterial insufficiency, and the lower you get, the more severe. So next, let's have you scoot down here a little bit. I'm just going to have you sit up the way you were. There you go. And now we're going to do the monofilament testing. I don't have a fishing line or anything like that, so we're just going to show the points off like this. So what I want you to do, Mr. Kopic, do you feel this? So when you feel it, I want you to tell me, okay? And we would start off with the 5.07 monofilament, and I only press it until the little monofilament bends, and then that's as much as I push it. The 10 spots here, I hope that comes across well, is the first toe, and of course you have his eyes closed, so big toe, third toe, fifth toe, and then the metatarsal heads of the same toes. So 4, 5, 6, and then we got 7, 8, and around the midfoot, and then we have 9 up here in the middle of the heel, and then the 10th point is right in between the dorsal aspect of the web space in between the first and second toe. So we'd compare that, both sides. And then, all right, last but not least, let's have you put your hospital socks on. Please, sir. And then when you do that, I'm going to grab a gait belt. All right, Mr. Coffee, let's step off this way here. And you feel good, no dizziness or anything like that. Is that correct?
Yeah, I'm good.
Good deal. You're a specimen, Mr. Kopic.
That's what my wife says.
That's what your wife says?
Yeah.
Okay.
I'm not married though.
Oh. Okay. Hey, no judgment. No judgment here. I'm just here to get you better. All right. Let's have you stand up.
Okay.
All right. Let's just get your balance here first. Feel all right?
Mm-hmm.
All right. So let's step over here, and what I want you to do, and we're going to go out of frame for this, unfortunately. I just want you to walk about 10 yards or so. Just before you hit the wall, turn around, and then come back. So what I'm really doing here is I'm making sure he's, spending roughly the same amount of time in stance and swing on both sides, looking for an antalgic gait pattern, making sure, and then go forward, and then turn around before you hit the wall. Making sure he's striking with his heel and then rolling over and pushing off with his, primarily his big toe. Looking for any out-toeing, that's good there. And then you can sit back down, Mr. Kopic. We didn't note any hallux, limitus, rigidus, or Charcot foot, that rocker bottom. And your gait looked, your walking looked good, Mr. Kopic.
Awesome.
Good work, man. It was lovely working with you.
As always.